In this chapter, we'll be covering 3 genuses of spirochetes. The term spirochete refers to bacteria that are spiral-shaped. The one we're going to talk about in this segment is Borrelia burgdorferi, the cause of Lyme disease. This scene will take place at an archery competition in the forest, so we've titled it The Bows and Arrows of Borrelia. Let's start drawing out the forest in this mythical land of Borrelia. So first of all, you should know the primary geographic distribution of this disease. It's the northeastern United States, especially in states such as New Hampshire and Connecticut. To remember this, we'll call the archery competition the Northeast Archery Competition. We'll make a sign here on the tree to help you remember this. And question stems often include someone who just got back from a hiking or camping trip in the forest, hence the forest scene. The reason people contract Lyme disease from wooded areas of the Northeast is because it's a tick-borne disease, and the particular species of tick that's been known to transmit Lyme disease lives in wooded areas. So to help you remember that it's a tick-borne disease, we'll draw a tick on the sign here too. It's not unreasonable to be expected to know the name of the specific tick species. It's the Ixodes scapularis species. To help you remember the name, we're going to introduce our first contestant in the competition, Robin of Ixodes. This is a play on the Robin of Locksley from Robin Hood, and it should be strong enough to help you recall the word Ixodes in the context of the Borrelia archery competition. You should also note that Ixodes tick is involved in the transmission of 3 diseases, Lyme disease, ehrlichiosis, which is another bacterial disease, and babesiosis, which is a protozoal disease. We'll talk more about these other diseases in future videos. Test writers also think it's important for us to know certain aspects of the life cycle of the Ixodes tick. I don't really understand why. I'm not planning on treating ticks, so I don't find this terribly important, but maybe some of you do. So we've included it. The tick's larvae feasts on the white-footed mouse, and the adult form feasts on the white-tailed deer. Keep in mind that the white-footed mouse is the main reservoir for the tick, and the white-tailed deer is an obligatory host. We'll draw a mouse and a deer here in the forest to help you remember this. Since the tick is what's transferring the bacteria, it is the vector. To remember that the mouse is the reservoir, the host of the tick larva, just remember that the larvae are the smaller form of the tick, and mice are small. The deer has the larger adult form, and deer are large. You'll notice that we haven't mentioned humans in the tick life cycle. Well, that's because we don't play an obligatory role. We're referred to as an incidental or dead-end host. Alright, that's it for ticks for now. Let's move on. Spirochetes don't gram stain because they have really thin walls. Borrelia is somewhat special because you can visualize it under the microscope, but it takes certain stains. The other spirochetes, Treponema and Leptospira, can't be visualized under regular light microscopy. So you should be able to recognize 2 stains that you can use on Borrelia, and they're called the Wright stain and the Giemsa stain. To remember this, we'll introduce the other 2 contestants in the archery competition, Sir Wright and Sir Giemsa. Notice all of our contestants are wearing a bright green. Well, we've made them wearing a lime green because we're going to use these contestants to help us illustrate the stages of Lyme disease. Lime green for Lyme disease. Okay, now that we have our contestants, let's move on to the symptoms. There are 3 stages of Borrelia, and they all have very different symptoms. And we're going to teach you all of them one by having 3 separate stages in this archery competition. We'll start with the first stage. This stage is known for a characteristic rash called erythema chronicum migrans, or more popularly referred to as a bullseye rash. This rash isn't painful or pruritic, and it usually occurs within about a month of the tick bite, but it is a hallmark of Lyme disease, so you better know it. And it seems like this bullseye rash fits quite nicely into the story about archery. To represent it, we'll put a bullseye target here on stage 1. Now that we have a target there, let's make things a little interesting. We'll have Robin of Ixodes splitting Sir Wright's arrow right down the middle. This split arrow has taken on a spiral appearance, resembling a spirochete. That's pretty cool. Robin of Ixodes clearly just embarrassed Sir Wright, and now he's seriously questioning whether he should have entered the contest in the first place. He's so nervous, he's sweating and looking feverish, which will remind you of the flu-like illness that accompanies the rash in stage 1. So stage 1 is a rash with fever and chills. Let's move on to stage 2, which is characterized by more serious symptoms. We're going to use a target again for stage 2, but this time there's a guy standing in front of it, setting up a whole William Tell situation, but without the apples. He's not really at all trusting that these archers are able to hit the target without hitting him, so he's carrying a shield that he can use to block any misguided arrows. And on the shield, we're drawing a heart. This represents one of the manifestations of stage 2 of Lyme disease, heart block caused by myocarditis. And the other manifestation of stage 2 that examiners could possibly ask you about is a bilateral facial nerve palsy. Idiopathic facial nerve palsies are known as Bell's palsy. So we've added bells hanging down on both sides of the guy's face to signify bilateral Bell's palsy. And that's it for stage 2, Bell's palsy and heart block. Let's move on to stage 3. We'll have a straw man that is swinging in front of a target so that the contestants have an even harder challenge in hitting the target. In case you can't remember which challenge is which, just remember that we've made the challenges progressively more difficult. We have a blank target for stage 1, then a stationary man blocking the target for stage 2, then the most difficult is a swinging man blocking the target for stage 3, and that should help you keep things straight. Sir Giemsa hasn't quite figured out the timing of this swinging, so we'll have one of his arrows hitting the mannequin's knee. This is to help you remember that in stage 3, patients can suffer from arthritis of large joints, such as the knee. There may also be arthritis of other joints, and the symptoms may actually move from joint to joint, so this is known as a migratory polyarthritis. The fact that this straw man is swinging should help you remember the migratory aspect. Finally, for stage 3, we have some subtle encephalopathic or CNS effects that you have to remember. It could present really just as memory difficulty or as cognitive slowing or a lymphocytic meningitis. To help you remember these CNS effects, we'll add an arrow going through the mannequin's head. Giemsa, who's flabbergasted by his inability to hit the target, is looking confused himself. And this is to further solidify this subtle encephalopathy. So to review, stage 1 is the bullseye rash with flu-like symptoms, stage 2 is heart block with bilateral Bell's palsy, and stage 3 is migratory polyarthritis of large joints and encephalopathy. Treatment for a Borrelia infection should be started as early as possible, ideally in stage 1. At that point, doxycycline will usually be used and is effective. We'll use our recurring bike wheel symbol to remember doxycycline, and have Robin of Ixodes really showing off his dominance by performing all of these miraculous feats while on a unicycle. The other treatment you need to remember is ceftriaxone, which is used for more severe or later presentations of the disease. We'll use our recurring symbol, the 3 axes, to help you remember this. Let's strap a shield to Robin of Ixodes' back with the 3 axes on it. We've used this symbol in another medieval competition. Do you remember which one? That's right, it was a symbol in Strep Pneumo tournament. And that's it for Borrelia burgdorferi. Learn it so well that you forget where Robin Hood is really from. From now on, it's Robin of Ixodes. Then, be sure you can recall each of the 3 stages, and remember that hint I give you about them being progressively more challenging so that you'll always be able to keep them straight. And that's all.